mRNA vaccines are credited with saving lives during the COVID pandemic, and there's an effort to further develop mRNA to fight other viruses and even cancer cells. But the vaccines have been criticized by Health and Human Services Secretary, that is, Robert F. Kennedy Jr. So what is the future of mRNA, we ask? Dr. David Engethaler, Executive Director at ASU's Health Observatory. Good to see you again. Thanks for joining us.
Good to see you, Ted.
Before we get too far down the road on mRNA, what is mRNA and why is it different than vaccines of the past?
Well, mRNA is something that our body creates anyways. All living things create mRNA, which is that it essentially is transcribing a chunk of your genomic material to say, this is the protein we need to make. These are the building blocks we need to make for our cells or for anything that's living. So we make mRNA, little transcripts of genomic material all the time. We can use that to actually make vaccines against foreign invaders or against bad things in our bodies, like cancer.
I was going to say, have we gotten to the point where mRNA, it sounds like you're at the cusp, maybe even involved with cancer cells?
Yeah, it's really exciting. We can talk a little bit about, how the vaccine was used during the pandemic and all of that. It was really broad scale. But with the idea that we want precision medicine, precision health, that's what mRNA vaccines do. We can be very precise about people's cancer. We can actually sequence the cancer and make the vaccine very targeted for that person and their cancer specifically.
And vaccines heretofore have been what? Basically live viruses, and it's kind of a messy process, isn't it?
Yeah, I think when we think about vaccines, they're really 20th century and earlier technology where we're using either an attenuated live virus or a killed virus or just proteins from a virus or a bacteria, depends on what the vaccine is. And then you inject that and the body's immune system responds to that. So then if you actually get infected with the bad organism, your immune system can respond. Now with mRNA vaccine, we don't need to inject all that stuff. We can actually just give that little code that your body can take that and make proteins from. And then those proteins are what your antibodies respond to, what your T cells and your immune system actually responds to.
Is the lack of understanding of what you just said among the reasons why there are still folks up to it, including RFK Jr., who just think that this is a foreign thing that doesn't belong in the body?
Yeah, it is kind of hard to understand why people at higher levels aren't fully understanding this, because it's been really well described now for the past several years, especially during the pandemic. Mm-hmm. It's a natural biological process. It's not invading your DNA, it's not changing your genome or anything like that. It's essentially just shortcutting some of the steps of what your overall immune response is to a foreign invader so that you're ready to deal with it when you actually do see it or when you get that cancer.
And it was effective. I mean, people forget, this was a very effective way to fight the pandemic.
It was pretty amazing. It allowed just this ability, it allowed us to come out really quickly, as you knew, Operation Warp Speed.
Yes.
Unbelievable. We wouldn't even think Hollywood could come up with such a crazy timeline as what happened. And it was very effective, especially during the early stages when the virus hadn't spread everywhere already and everybody had some level of immunity. Saved a lot of lives, especially in those highest at risk, those especially our elderly. So really did make an impact.
And as far as the mRNA is concerned, and you mentioned how quickly it was developed, is that among the positives, the benefits of I mean, again, you don't have to go through the testing and the thing with the live virus and the inactive. Yeah. This sounds like it can be activated pretty quickly.
It definitely can be activated quickly. And what's really exciting about thinking about cancer vaccines and cancer treatments with mRNA is it's very targeted because it's very programmable against your exact cancer or your exact tumor. As opposed to what we did during the pandemic, we gave it to everybody. And when you do that, you're going to see things you weren't expecting, right? And we did have some bad outcomes, and it wasn't perfect across the board. But when we're very targeted, all the initial cancer trials are looking very interesting.
Well, and also you mentioned the broad way it was applied for the pandemic. That could still be used if another pandemic rolls around. Broad is better than nothing.
Oh, 100%. And we've learned so much, obviously, from the rollout. Maybe we can be more targeted for the people that are most affected by whatever the next thing is, as well as we can quickly understand what might be the bad effects.
RFK Jr. said there was not enough long-term testing and the COVID shots were hastily approved without proper vetting. Is he correct there? Does he have a point? What do you think?
I think that it probably didn't follow the normal vetting and the normal number of trials. but we were in an emergency. We were in a pandemic. We didn't know how bad it would be. Remember the earliest versions of this virus, we were seeing a lot of deaths. And so the faster we could put something out with appropriate testing certainly was a good thing. But we also needed to watch very closely. And of course, there's a lot of things around policy and mandates. That's different than the actual technology itself. So let's make best use of this great scientific advancement.
One more point here, because I have to mention him because he is basically the country's health director. He said that they were the deadliest vaccine ever made. How do you get past that, especially with research on stuff like cancer and other viruses that's going on?
Yeah, unfortunately, if we're going to talk about really how this was during the pandemic, we have to say everything was tainted with politics. And we really weren't getting good scientific understanding. And so this is why you have statements like that. I think we got to kind of step back and look at actually what did we learn from this and how was it used? Maybe in some cases it wasn't the best, but the old vaccines, if we would have used some of the old vaccines or the non-mRNA vaccines on everybody, we would have so many worse outcomes. So thankfully, we had less, but there's still things that we can learn and improve.
And again, last point here, didn't mean to interrupt you, but the last point, cancer, HIV, Zika virus, all these things, it is possible to get an mRNA. First, is it possible? And secondly, how soon?
It really does seem that using this technology, we can really program it to respond to almost any invader and almost any cancer. So there are dozens of trials right now for cancer. There are many other trials for other pathogens as well. So all this is happening during a non-emergency, and all the proper testing and vetting is happening.
Sounds like you're pretty optimistic.
I'm very optimistic.
Dr. David Engelfaller, again, good stuff, good information, encouraging information. Good to have you here.
Yeah, thanks, Ted.